I think I'm in danger. I think a lot of other people are too.
I live in subsidized senior housing. We're all in the same, there's like 200 people in there that are all in the same boat.
Well, those are just some of the concerns the Oregonians we talked with today are having about the incoming cuts to Medicaid. On Independence Day, President Trump signed into law his big, beautiful bill, which includes a slash to Medicaid, food stamps, and the Affordable Care Act.
But we made promises, and it's really promises made, promises kept, and we've kept them. This is a triumph of democracy on the birthday of democracy, and I have to say that the people are happy. They're happy. I've never seen people so happy in our country because of that, because so many different groups of people are being taken care of, the military and civilians of all types, jobs of all types. We're adding things like the biggest tax cut in the history of our country, child tax credits. So many things are being added that we wouldn't even have time to discuss them.
Now, according to the Associated Press, more than 10 million Americans rely on Medicaid for health care. It's a joint federal and state program that provides health insurance to low-income adults and families, people with disabilities, pregnant people, and seniors. And President Trump's bill includes about $1 trillion in cuts to the program, which is expected to result in millions of Americans losing health insurance.
The only way I'm able to get mental health benefits, the only way I'm able to get physical therapy, the only way I'm able to get really any medical help at all, and I'm 23 years old, is through Medicaid.
Well, I'm a low-income senior. I live in low-income senior housing. I mean, Medicaid is what paid my bills, my medical bills and stuff. Now I can't go to the doctor.
Oh man, I would be desperate, yeah. Yeah, that would cause me some desperation.
Now, these cuts are not happening right away. A timeline created by the New York Times suggests cuts to Medicaid work requirements could start in 2026 for most states. Medicaid and food stamp funding changes won't start until 2028. But those of you who are not on Medicaid, well, you still could be impacted. Democrats, including Oregon Senators Ron Wyden and Jeff Merkley, sent this letter to President Trump warning more than 300 rural hospitals are at risk of closing because of the bill. Rural hospitals, they say, care for a higher amount of Medicaid patients. Worth noting, the president's bill does include money for rural hospitals to be given out over 5 years, but some argue it won't be enough to offset the losses from Medicaid cuts. Governor Tina Kotek also speaking out against these cuts recently. Listen.
The Medicaid program, the SNAP program, is a lifeline for Oregonians. Our rural and frontier areas are going to be devastated. We will lose hospitals, we will lose providers, and most importantly, people are going to suffer because of these cuts. What you hear from Washington, D.C., that this is bureaucratic bloat that we need to cut. We know how to run cost-effective, effective programs in the state of Oregon. This is not bureaucratic bloat.
And a spokesperson for Providence Hospital sent us the following statement, saying in part, eliminating nearly $1 trillion from Medicaid and the ACA marketplace funding over the next decade will impact every patient. These sweeping reductions will limit health services, lead to care delays and longer wait times, especially in emergency departments, and place undue strain on overburdened healthcare providers. Now take a look at this. This dashboard from the Oregon Health Authority shows about 1.5 million Oregonians are currently enrolled in Medicaid. This map shows the concentration of Medicaid recipients by county. The darker blue is more people. The highest percentages are in rural counties, mostly in eastern Oregon. Malheur County has the highest. 54% of people there are on Medicaid. Across the state, 34% of Oregonians are enrolled, 1 in 3. In over half of the state's children, 59%. Okay, joining me now live in studio is Eric Hunter, the CEO of Care Oregon. That's the largest Medicaid insurer in the state, covering more than 500,000 Oregonians. Mr. Hunter, thanks for coming on the show.
Thank you for having me.
Okay, so let's back up here. For those at home who don't know, explain what Care Oregon is and how Medicaid falls into what you all do.
Care Oregon has been serving the Medicaid population under the Oregon Health Plan for 30 years now. We're currently the largest provider of such services with members across the state, down the I-5 corridor from the North Coast, the Metro, Jackson County, and tribal care coordination across the state for our Native American partners.
So what are you expecting the impact from these cuts to be like here in Oregon? Like, should people be concerned?
People should be concerned, not for the immediate impacts of this bill, now law. I think the things that are built into it, though, are so massive that they will fundamentally change the funding structure for the entire healthcare system. It's not just Medicaid. If rural hospitals close, as the senators have mentioned, even those folks who have jobs or can pay for themselves won't have access to healthcare, and that's really critical. The healthcare system, as we speak, is very fragile. It is already struggling with workforce shortages, with ER and utilization, SUD and behavioral health needs, and thinking that this is coming down the pike is really stressing the system.
So let's talk about timeline a little. What is the timeline of these cuts that you've been hearing?
Yeah, the vast majority of them are set to take place in 27 or in 28. However, most of them are not very clear-cut removals of people based on specific criteria. They're administrative burdens. They're hurdles that are placed in front of people to make it so that they either give up or can't qualify or can't navigate the system through either paperwork or have a wrong address. So that's when people are going to drop off the rolls mostly. It won't be that they don't deserve the health care they're getting. It'll be that they can't go through the administrative burden. And the state actually needs to set up systems, and companies like Care Oregon have to develop systems that we can help them navigate that.
So today, we heard from some people worried they might lose their health care because of this. So what kinds of services could they realistically lose under this bill?
Under this bill, I think most people who lose care will lose care completely. They will not get any Medicaid services, but that doesn't mean they won't need health care services. And that's the big dilemma, is that if people no longer have Medicaid coverage, they're no longer getting preventive care, they're no longer going to doctors before they get particularly sick. They wait until something bad happens, they go to the ER, they go to the hospital, and those places are already overstaffed and stressed out. And so people will still get sick, they'll still need care, but it'll be much more acute and much higher to cost.
So we know 70% of children in rural parts of Oregon rely on Medicaid. That's according to the governor. So if a family loses coverage from these cuts, what do you suggest they do? Is there anything that they can do?
The first thing is to try to make sure they don't lose coverage, right? Because a lot of the hassles will be administrative, that we have to make sure that people keep their addresses up to date with the Oregon Health Authority and with the state, that they pay attention and work with community partners and companies like Care Oregon and other coordinated care organizations to make sure that they're paying attention to the timing of these things. So if there are work requirements, if there are eligibility renewals they need to do, they're taking care of that in advance. But once they lose coverage, there are very few options left.
Let's talk about a piece of that. We know more people are going to have to prove that they're working to qualify for Medicaid.
Right.
How do you see that impacting Oregonians?
What's interesting is that this is spoken of as if it's going to fundamentally change who is deserved of health care coverage. The majority of those folks in the expansive population already work if they're able to. There are a number of exceptions as well in the bill, and so that's why I say that it's not that people don't deserve coverage. It'll be so onerous to keep it and to qualify and to fill out the paperwork, they'll either give up because they don't think they have a health care need right now, or they just will miss a date or not fill out a form on time. So, I think that's going to be the real hassle.
Have you been contacted by the federal government asking about Oregon's Medicaid program?
Care Oregon has not been contacted by the federal government. We know that there are a lot of conversations happening, obviously with the state and CMS and the Department of Health and Human Services, but no, we are a subcontractor of the state of Oregon. And so we'll follow the rules and regulations that they set forth, the contracts we have with them, but we've not talked to the federal government.
Are you expecting maybe to receive a call, or?
I don't anticipate it. I would hope not. We're doing everything right.
Okay. I want to read you a social media post now from Republican Congressman Cliff Bentz. He represents Oregon's 2nd district, primarily rural Oregon. His district has the highest number of Medicaid recipients in the state. That's according again to Governor Kotek. Okay, here's what he says. I voted yes on the big, beautiful bill. I voted yes because I believe that the laws and policies contained in this bill, among many things in the bill, will protect America's credit, drive the economy to new heights, and begin the long and difficult road toward reducing dependence on government. So from your standpoint, leading Care Oregon, let's focus in on that last line there, reducing dependence on the government. Right. Will these Medicaid cuts accomplish that, and at what cost?
No, it won't. And what's particularly interesting is that Representative Bentz represents southern and eastern Oregon. We manage a coordinated care organization in Jackson County. And so my members and my employees are his constituents. This will not weed out folks who are undeserving of care. I think that those folks that end up getting sick anyway and go to the ER, go to the hospital, if there is a hospital, the federal government ends up paying for those costs as well. And I think it's disingenuous to believe that people will just not get care anymore. It's just not a viable solution.
Okay. Well, Mr. Hunter, CEO of Care Oregon, thanks for coming on the show.
Thank you for having me.
All right, everyone, it's your turn. What is going through your mind about these cuts to Medicaid? Did our interview tonight help you better understand what to expect? Do you have any other questions? Let us know. Email the story at kgw.com or call and leave a voicemail, 503-226-5090.